So welcome to the channel. Today's presentation is going to be on the pathway to medical and dental schools in Ghana. How do you become a doctor or a dentist in Ghana? The aim of this video is to show you the step-by-step approach, give you more information about medical schools and their requirements and how one can become a medical doctor or a dentist in Ghana. The target audience are going to be prospective applicants to medical schools and dental schools in Ghana, parents, guardians, teachers, especially those in junior and senior high school, because they have to appropriately counsel students and their parents to know exactly what course to offer in the senior high school level. And of course, medical and dental students already in training can also find this video really useful. So by way of introduction to medical and dental schools in Ghana, remember that if you want to become a medical doctor or a dentist in Ghana, you have to go through training. And the training takes place in medical or dental school that is accredited by the regulator, in this case, Medical and Dental Council of Ghana. So the school, the medical school or the dental school you decide to go, doesn't really matter. You can decide to train here in Ghana, or you can decide to go outside the country to train. But after your training, you are expected to write a common licential exam, after which you are given a license to practice medicine or dentistry here in Ghana. So you must take note that you can either train outside the country or you can train within the country. This video is going to focus more on what to expect if you decide to train here in the country to become a doctor or a dentist. So medical education started as far back as 1964 by our first president, Dr. Kwame Nkrumah, and the premier university is the University of Ghana Medical School. So University of Ghana Medical School is the premier university for training doctors here in Ghana, because it started as far back as 1964. But before the establishment of University of Ghana Medical School, all doctors that practice here in Ghana have to train outside the country. So the local training started actually in 1964, and today Ghana has 5 public universities and 4 private universities, making a total of 9 medical training schools for the country. Out of the 5 public universities, 3 of them offer dental training, and 1 private university also offers dental training, making the total dental schools for the whole country to be 4. So Ghana has 4 dental training schools. For medical training, all the 9 schools train doctors, medical doctors, but only 4 train dental practitioners. So now let's take a look at the public universities or the public medical schools in Ghana. So the premier is the University of Ghana Medical School, which is located in Accra, train doctors, and I've been training doctors for Ghana for several years now. The second medical training school for the country is the Kwame Nkrumah University of Science and Technology School of Medicine, located in Kumasi, also train medical doctors. Then the third medical university that was established for the country is the University for Development Studies School of Medicine, that was in Tamale, also trained medical doctors for the country. Then after that, we have University of Cape Coast, School of Medical Sciences in Cape Coast, also trained doctors. And the newest addition to the list is the University of Health and Allied Sciences, UHAS, School of Medicine, located in Ho, also train medical doctors. So these are the 5 public universities that train medical doctors. Now the private medical universities that train medical doctors for the country are Accra College of Medicine, located in Accra, Family Health University College, also located in Accra, College of Medicine and Allied Sciences, located in Accra, and Entrance University of Health Sciences, School of Medicine, also located in Accra. So 4 private universities have been accredited to train medical doctors, and all the 4 universities are located in Accra. For dental schools in Ghana, as I already mentioned, there are 4 of them, and here are the list. University of Ghana Dental School in Accra, Kwame Nkrumah University of Science and Technology School of Dentistry, also located in Kumasi, University for Development Studies, School of Dentistry, Tamale. And whole really has not started dental training yet. So to give you more insight into what I'm saying, I looked this up at the Medical and Dental Council's page to see the universities, the various medical and dental schools that are accredited to run programs in Ghana. And here is the list. As you can see, we have the 4 private medical schools here, and also the public school. And you can see that out of the 4 private, only 1 is accredited to run regular dental program for the private, and for the public, only 3 of them are accredited. So you can see University of Ghana Dental School is accredited to run dental program. Kwame Nkrumah University of Science and Technology is also accredited to run a dental program. And of course, the University for Development Study located in Tamale also is accredited. You can see this accreditation is new. This is as of September 2025. You may have to always refer to the Medical and Dental Council's official page every year to see schools that are accredited, because this list can be modified at any time, So that's about the schools that we have. Now you know the schools, you know what programs they offer and all that. But you need to also know the requirement or what it takes to get admission into medical or dental school in Ghana. All right, so what are the requirements for admission into dental and medical school in Ghana? The first and perhaps the most important requirement is that you have to study general science at the senior high school level. This is the most important requirement. Remember, medical school admission is not open to people who study business in senior high school, general arts, visual arts, and the rest of the senior high school courses. You necessarily have to study general science in the senior high school level to qualify to apply for admission or for consideration to be admitted into medical or dental school in Ghana. And the elective courses you should have done should include biology, chemistry. You can add physics or elective maths to the electives. And of course, you need also your core subjects, your English language, your social studies, your integrated science, and also core mathematics, right? You need the 3 core subjects, specifically the core mathematics, integrated science, and English language, together with 3 elective, of which biology and chemistry has to be part of. So this is the basic requirement to be considered for admission. Then after you have satisfied this requirement and you have passed your exam and get a very good grade, then you can apply to the university with your WASI certificate to be considered for regular admission to study medicine and dentistry. So right from SS, it's possible for you to study medicine or dentistry in Ghana, but you must first of all study general science and have the electives and core that I've already mentioned, and then you must have a very good grade. You need a very good grade because the admission is really competitive. Therefore, you need to get a good grade so you can be considered for admission. So that's one pathway of becoming of gaining admission into medical or dental school. The other pathway is that you can go to the university and study a bachelor in any of the science-related areas. And after you have completed your bachelor in these science-related areas, you can use your bachelor degree to apply for admission into a graduate entry medical program. So that's slightly different from the WASI holders. The WASI holders need a science background, a good score at the WASI, and then they can apply directly for admission into a regular training. And those with degrees, or those who did not apply directly but have gone to do other courses, can apply with their bachelor degree to be considered. It is bachelor degree, not a diploma, not a certificate, not a master's degree or PhD. You need a Bachelor of Science degree to apply for consideration to be admitted into a graduate entry medical program. But remember, the basic requirement is that you should have already been a science student before you present your bachelor's degree to be considered for admission. So these are the two routes for gaining admission into medical school. Then after you have applied, either as a regular student or as a graduate student, you will be shortlisted to go through an entrance examination. And the entrance examination, usually the content of what you study differ from the schools. I mean, in Accra, what they study is slightly different from what is done in Tamale, for instance, or what is done in Kumasi. But the baseline is that you'll be shortlisted to undergo an entrance exam. This entrance exam is unique for your level. So if you are a graduate applying for admission, you have to go through a preparatory course, then you write the entrance exam. If you are a WASI certificate holder, your entrance exam is also unique to your level. So the levels are not the same, but the end result is that irrespective of which group you belong to, you are going to write an entrance exam. After the entrance exam, and you are lucky, then again you are shortlisted to attend an interview. And this selection interview is the final step for your admission into medical or dental school in Ghana. The interview also differs. It depends on where you are. The questions you are asked differs, but the whole idea is to be able to select the best candidate into the program. So these are the things you have to go through. And if you are a prospective candidate, you must prepare yourself to be able to write the entrance exam and pass, and also go through the interview and pass. Perhaps in our subsequent videos, we're going to share some of the things you should expect for the entrance exam and also for the selection interview. So after your admission into the program, the next question is, how long are you going to train for? Medical school, for regular students who apply with WASI or WASI holders who apply for admission and get admitted, will study for 6 years. 6 years. These 6 years, we're going to talk about what you're going to do in the 6 years. But for the graduate applicants, they are going to study for 4.5 years or perhaps 5 years. So these are the durations that you should note. WASI holders, 6 years, and then graduate admissions are for 4.5 years or maximum 5 years. Now, the structure of training of doctors in Ghana is divided into two phases. The first one is preclinical training phase, and the second one is a clinical phase of training. So preclinical is for the first 3 years for regular students. The WASI holders, the first 3 years of your life in medical or dental school, you undergo a phase of training called preclinical phase of training. And for graduate or the graduate student, you will study for 1.5 years. 1.5 years as preclinical, right? Then from there, both the graduate and the graduate student and the WASI holders all move to the next phase of training, which is the clinical year, and that will also last for another 3 years. It is the same for both graduates and WASI holders. There's no difference for the two cohorts, no difference at all. The only difference is that at the preclinical level, graduate holders may study for 1.5 years and WASI holders will study for 3 years. But after you move from this level and enter into the clinical phase of training, the duration of training is the same for both cohorts. Now, preclinical training in Ghana focuses on building a solid foundation for study of medicine and surgery or dentistry. So trust me, at the preclinical level, you are not really taught anything medicine or surgery. You are rather being trained, or your foundation is being laid so that it becomes easier for you to study medicine and surgery. Okay, so essentially you're going to study medicine and surgery for 3 years, but that solid foundation must be laid during the preclinical year of training. And some of the things you'll be doing during the preclinical year include basic medical sciences like anatomy. So anatomy is knowing the structures of the human body. From head to toe, you're going to be taking through the structures of the human body. Physiology deals with the functions of these structures, and you're going to be taking through this histology, where you study cells and tissues at the lowest level. You study the human being at one of the lowest level. Biochemistry and all that. These are basic medical sciences that you do in the preclinical year. You do also apply sciences like pharmacology, microbiology, pathology, etc. You do all these in the preclinical year, and of course you do dissection. So this is where you go to the school morgue or the medical school morgue, and then you do a lot of, there are cadavers there. Cadavers are dead bodies that are preserved for teaching in medical school. So you're allowed to dissect so that the structures that you learn in anatomy, you can see them and see how they look like. You do a lot of lab work, you do a lot of experiment, clinical skills. You'll be doing examinations on yourselves and also on dummies and all that. You'll be taking through history taking, ethics and communication and all that. All these things form part of your preclinical training, and this will last for WASSCE holders 3 years and for graduate holders 1.5 years. Again, preclinical training is usually done in the university campuses. So remember that all the universities that are mentioned in Ghana, they are teaching hospitals are really not attached to the university. The universities are detached from the teaching hospitals. So preclinical training is usually done on the university campuses. So for instance, if you come to Tamale, University for Development Studies is so far away from the teaching hospital, which is Tamale Teaching Hospital. So preclinical, we remain in the university and take courses and all that. If you go to Kumasi, it's the same. Komfanochi Teaching Hospital is so far away from KNUST, and of course, similar thing for Kolebu and Cape Coast and all that. So preclinical training takes place in the university, and then the approach can differ depending on where you are. I'll give you an example. If, for instance, you are studying in UDS in Tamale, you are going to be taught using a methodology called problem-based learning methodology. Whereas if, for instance, you are studying in Accra, you would have been taught using the traditional model of teaching. So there is the approach to teaching you will vary depending on the university you find yourself in. Or some universities actually combine both. For instance, I am aware Cape Coast University really combine both traditional and problem-based learning methodologies to teach medical students. We will talk more about these approaches of teaching and see the merit and demerit of each of these approaches, and it can help you to select which university you are interested in to train as a doctor. Now, at the end of your preclinical level of training, you are awarded a degree, and this degree also has different names depending on where you train. For instance, if you train in the University of Ghana Medical School, the degree you are awarded at the end of your 3 years of study is Bachelor of Science, Medical Science. If, for instance, you study in KNUST or UDS, at the end of the 3 years of study, you are awarded Bachelor of Science, Human Biology. So at the end of 3 years preclinical training, you graduate from preclinical school with a bachelor's degree. And the name of the degree is the Bachelor of Science, Human Biology, or Bachelor of Science, Medical Sciences. So what does that mean? It means that at the end of 3 years, you can exit and go and do master's degree somewhere and proceed to do PhD if you don't intend to become a doctor. Okay, so there is that flexibility, and you must know about it at this stage. Then after you have graduated from, of course, another very important thing you should know about preclinical training is that before you transition to clinical school, usually you do what we call lab coat ceremony, and it's where it's a very fancy ceremony where you don your lab coat and you go through a process to, because clinical year training is all about wearing lab coats and all that. So it's a symbolic ceremony to transition you from preclinical school to clinical school. And usually many universities do this, and it's all over the internet. You can look it up and see how beautiful it looks. So that's about the end of preclinical training in Ghana. Now, when you transition to clinical phase of training, you usually move from the traditional university where you were training earlier to the teaching hospital, and your life is going to be around the teaching hospital till you are done with medical school. So take, for instance, if you were studying medicine in University for Development Study in Tamale, The first 3 years of your life, you'll be on campus, University of for Development Studies campus, okay, at Dungu. Then after the 3 years has elapsed, you move from Dungu to Tamale Teaching Hospital, and you will remain in Tamale Teaching Hospital till you are done with your training. So the clinical phase, there is a transition for you. Once you enter clinical school, first year clinical school, you are taking through a lot of courses to transition you from preclinical to clinical. Remember, in preclinical, you were not reasoning as a doctor, you were not being trained as a doctor, you were given raw fat and all that. But in clinical school, they have to reorient your mind and prepare you to become a doctor. So there is a form of training you receive in your first year to make you a doctor. Then from there, you have a lot of clinically oriented training. You have a lot of bedside teaching. You have a lot of examination to do on patient. And this time round, you have real patient, real patient with real medical condition. So you have real-time patient encounters. There are a lot of rotations you have to go through in major specialties and subspecialties. Okay, and you also take a lot of lectures from the teaching hospital. So attached to the teaching hospitals are your lecture blocks. Okay, the medical school for clinical year has lecture blocks attached to the university. You take lectures from there. You do a lot of presentation by your own and even as a group over there. And there are a lot of rotation, end of rotation assessment and examination. So in clinical year, every 4 weeks, every 6 weeks, every 3 months, you are writing an exam, because once you end a rotation, you have to write the end of rotation exam. So there are a lot of exams you have to write in clinical year. Usually, like I indicated, the training is done in teaching hospital, which is usually detached from the traditional university where you have been admitted. And at the end of the 3 years rotation, you sit for an exam, and after passing your exam, you are awarded in Ghana. Please take note of the degree you are given at the end of the clinical school. You are given a Bachelor of Medicine, Bachelor of Surgery degree. Bachelor of Medicine, Bachelor of Surgery degree. Other jurisdiction would have given you a medical doctor degree, MD degree. But in Ghana, the name of the certificate that gives you the title to be a doctor is Bachelor of Medicine, Bachelor of Surgery degree. And abbreviation is MBCHP. And this degree is what gives you the qualification to bear the title doctor in Ghana. I mean, when I mean doctor, I mean Dr. Med, right? All right. So basically that's it. The next slide, I will try to just give you a gist about the various universities or medical schools and their corresponding teaching hospitals in Ghana. So University of Ghana School of Medicine and Dentistry, the teaching hospital is Kolebu Teaching Hospital. That's the primary teaching hospital. But of course now, I mean, they can send students to RICH, they can send students to University of Ghana Medical Center, they can send students to 37 and all that. But the primary teaching hospital for University of Ghana Medical School is Kolebu Teaching Hospital. For for KNUST, the primary teaching hospital is Komfanochi Teaching Hospital, CATH, located in Kumasi. For University for Development Studies, School of Medicine, the teaching hospital is Tamale Teaching Hospital, located in Tamale. And then for UCC, School of Medical Sciences, Cape Coast Teaching Hospital is the teaching hospital for that medical school. And of course, for UHAS, located in Ho Teaching Hospital is the teaching hospital for the medical school. So this is the conclusion of everything I have said. The conclusion is this, that if you are a prospective candidate desirous of becoming a medical doctor or a dentist in Ghana, then there are 2 ways. The first is that you can apply to a medical or a dental school here in Ghana, or you can choose to study outside of the country. Now, if you decide to study here in Ghana, what should you expect? The first thing is that if you are a WASI holder, you need to study general science in senior high school to qualify to apply in the first place. If you are a degree holder, then you must still be a science student to qualify to apply for consideration to be admitted into a degree program to study medicine in Ghana. These are the raw facts that you need to know. Then after you have met these basic requirements, you then have to apply to your school of choice, and then your certificate will be vetted, and then you are shortlisted for an entrance exam. And the entrance exam also depends on your level. If you are a WASI student, you are given a corresponding entrance exam to write, and if you are also a degree or a graduate student, you are given a corresponding entrance exam. After this is done, you are shortlisted for an interview, and then if you pass the interview, you get admitted to study medicine or dentistry in Ghana. Now, after you are admitted, your training will be fragmented into two. You first of all have your pre-clinical training, which will take place in the university where you are admitted for 3 years for WASI holders and 1.5 years for graduate holders. From there, you are awarded a degree, Bachelor of Science Human Biology or Bachelor of Science Medical Science, and then you graduate and proceed to clinical school. And the clinical school is going to be 3 years. And within these 3 years, you are taken through many rotations, and at the end, you sit for an exam. And if you pass successfully, you are awarded a Bachelor of Medicine, Bachelor of Surgery degree. And this is what gives you the authority to call yourself a doctor in Ghana. So I hope to see you in the next video. Thank you so much for your audience.